I will begin by welcoming everyone back and introduce Dr. Libby Stuyt. Libby is a board certified addiction psychiatrist and has worked in the addiction and behavioral health field since 1990. She was the medical director for the Circle program, which is a 90-day inpatient treatment program funded by the state of Colorado for persons with co-occurring mental illness and substance abuse who have failed other levels of treatment. She retired from this position in 2020, and she is currently motivated to educate as many people as possible on the unintended consequences seen from the commercialization of marijuana in Colorado, focusing primarily on the deleterious effects of high potency THC on the developing brain and mental health. I have been so thrilled to get to learn from Libby, to get to know her personally. We have been together speaking on many sessions in front of legislators, senators, representatives, working on this bill coming up in Colorado. And Libby, it's been such a privilege and a joy to get to know you. So thank you for being one of Johnny's ambassadors.
Thank you. Happy to be here. Okay, well, I guess I will get started here. Many people still believe that marijuana is not addictive. So I am addressing the fact that yes, marijuana is addictive. So we want the slide to move forward.
I think you need to click on it. Click on your slide itself. There you go.
Yeah.
It got off your slide somehow.
All right. So one thing that we do know for certain is that commercialization of marijuana has dramatically changed it. So when we legalized medical marijuana in 2000, the highest potency of THC was 5%. And we only had the plants. We did not have concentrates available at that time. And so the potency was less than 5%. Now we have potencies ranging all the way up to 90, 99%, and people smoke it with a blowtorch. That has increased, this increase in potency has really made the substance a lot more addictive. And so if you think about it, marijuana has been around for thousands of years. It's always been up to the 80s, less than 3% THC, got up to 4% in the 90s, 5% in 2000. And now we have the average in 20% in the plant, and we have significantly higher in the concentrates. And we're seeing all kinds of problems related to this. And I just want to address the issue of addiction. So when you increase the potency of a drug, you increase the potential for addiction. And we know that about all drugs. And we are definitely seeing that with marijuana. In the olden days, when THC was less than 2%, we really didn't even think it was addicting because there wasn't really a noticed withdrawal syndrome. However, with this very high potency stuff, we are seeing a very marked withdrawal syndrome. And the Dutch figured this out. You know, the Netherlands has always been pretty tolerant of marijuana, but they recognized that when their potency in the plant got to 20%, like we have average now, there was a lag time, but there was this increased need for admissions for cannabis use disorder for treatment. They actually came out in 2016 and said they believe that anything higher than 15% should be considered a hard drug, like cocaine, and they capped the potency at 15%. And you can see there's been a decrease in the need for admissions for cannabis use disorder. So we see this very marked withdrawal syndrome now, and with some people it's worse than other people, and it really makes it difficult for people to quit. So people are irritable, they're angry, they're depressed, they can't sleep, they can't eat, and they have severe cravings for marijuana. And marijuana actually damages a lot of our body, and it has significant effects on not only our brain, but on our heart, our lungs, and our stomach. And I'm going to get into a few of those things. The younger you use marijuana, the more impact it has on your brain, because during adolescence is one of the most important times of brain development. And your brain is actually making decisions about whether it's going to keep certain neurons or get rid of certain neurons. And what happens is marijuana blocks this process because it fits into a receptor in your brain that's supposed to work for this, but it blocks it. And we see the results in people having lower IQs. They have more problems making decisions, more problems with social interactions. And then it actually can cause psychosis, where people are very paranoid, and it can increase the risk of suicide. It also primes the brain for other substance use. And so it does work as a gateway drug, and people getting addicted to not just cannabis, but other drugs. So as I said, your brain is basically under construction during puberty. And the last part of your brain to develop is the prefrontal motor cortex. So the front part of your brain where you make decisions, where you're making good decisions, healthy decisions, judgment. And when this isn't developed, it's hard to make good decisions. And marijuana plays a big role in this. So I just want to kind of do a little brief review of how addiction happens. This is the reward pathway in your brain, and this is where everything important that happens to you happens. So this is where you learn and remember to do important stuff. The problem with drugs of addiction is they work in this pathway, and they can actually hijack this pathway over your brain. This is a natural pathway. We have this pathway on purpose to help us survive. And so it's a pathway that helps us remember to eat. If you remember the first time you ate a really juicy hamburger, you remember how good it is, your brain is going, that's really good. We should remember to do that. And it does that by releasing dopamine in the nucleus accumbens, or in your reward pathway. And then it kind of gets hardwired into your brain, and you don't ever forget that you like juicy hamburgers. Or do you remember the first time you learned how to ride a bicycle? Do you remember how good that felt when you actually succeeded? Well, you got to release a dopamine that said, boy, this is important. We need to remember this. And so you do. And in fact, even if you don't ride your bicycle for years, and you get back on a bicycle, you do not forget how to ride because it's hardwired into your brain. So if you think about it, this is where dopamine is happening. Food causes a 1.5-fold increase in dopamine. That's that hamburger that says, that was really good, we should do this again. Drugs of abuse are even more significant. So nicotine even has a higher release, 2.5-fold. And methamphetamine or amphetamine has an 11-fold increase in dopamine. That's why that drug is so powerfully reinforcing, that says, wow, this is so good, we need to do this again. And all drugs of abuse do this. And as you continue to use drugs, addictive drugs, you actually see a decrease in dopamine. And this is over all addictions. So the only important thing here I want you to look at is the red. So the red are the dopamine receptors in the nucleus accumbens, or the reward pathway. So these are the people that don't have these problems. And so this is even in behavioral addictions. But if you think about it, smoking, nicotine does the same thing. So the nicotine user has less red. The person who's alcoholic has less red. The person who has a severe eating disorder, massively eating, has less red. And so we see this over and over again. But the good thing is, this is recoverable because, okay, come on. Well, and this is just a graph showing this. So we all have normal moods. We all have normal swings, up and down, up and down. When you use, and this is, when you're feeling good, you're a little less feeling good. However, if you use a drug of abuse, you get this really powerful surge dopamine. However, it's got to crash and burn. So it comes way down where you feel really bad. So you got to use to feel good again. It gets to the point where you have to use just to feel normal. But this is really recoverable. And this is important information. So this, again, we're just looking at the red. This is the dopamine receptors in your reward pathway. This is somebody who's never used these drugs and they have a lot of red. This is somebody who was abusing methamphetamine, 1 month abstinent. They don't have any red. Well, and that's why usually when people are coming off of meth, there's a crash and burn depression. It's very hard to treat that because our psychiatric drugs are used to augment our own natural chemicals. And if you don't have them, it's hard to feel better. But the good thing is the same person 14 months later, still abstinent, their red is back. And what really helps with that is getting a good amount of sleep, getting good nutrition, and getting good exercise. And that will really help with this recovery process. So this is the reward pathway, and I'm just going to go through this a little bit to explain kind of what happens. So this is the nucleus accumbens where the dopamine is released, and this says that's really important. And all parts of this area communicate via glutamate, which is the major neuroexcitatory chemical in the brain. And we can actually measure that looking at glutamate receptor ratios. And so what happens is, if you use a drug for the very first time, think about it. So you tried something like marijuana for the very first time, you get a release of dopamine in the nucleus accumbens that says, that was really good. So it sends a message to the amygdala, which is your warning system, or your scout, which is always scanning the environment, letting you know about anything that's happening, bad or good. And it says, next time you see that guy that gave us that marijuana, warn us. And sends a message to your hippocampus where you put your new memory and learning. Amygdala sees that guy, remember what he's good for. And then sends a message via glutamate to this orbital frontal cortex, which is your motivational drive system. Next time the amygdala sees that guy, go get him because he's got some good stuff. You just have to do that a few times and that gets hardwired into your brain and you don't ever forget it. The problem is if you're doing this as an adolescent, this is your prefrontal cortex. This is where you have inhibitory control or ability to put on the brakes and say no. This isn't working that well. So you tend to not say no, you tend to say yes and go. And so that's how it can happen more strongly during when your brain is developing. However, all drugs of abuse can actually decrease the effect of your prefrontal motor cortex. So even if you're an adult and you're using any addictive drug regularly, then this part of your brain is not working very well. So you don't make very good decisions. And then there's the effect on the hippocampus. So as I said, the hippocampus is the part of your brain where you put all your new memory and learning. And it is one part of your brain that actually has neurogenesis. So that means there's new cells being born and differentiating in that part of your brain on a regular basis. And that makes sense because you're learning something new all the time and you need to have new cells to be able to put that information into. However, if you use any addictive drug chronically, it can decrease neurogenesis in your hippocampus and shrink it. So there's actually imaging studies, like MRI studies, showing smaller hippocampuses in people that use alcohol, cocaine, methamphetamine, marijuana, heroin, or nicotine. And so this is a problem. And we actually can study this with animals like rats or mice. And this is a really fascinating way to study whether an animal is smart or not. It's called the Morris water maze test. So there's this very big vat of water in the middle of the room, and somewhere just under the surface is a hidden platform. And so you put the animal in there to see how long it takes it to bump into that block of wood and say, oh, good, now I'm not going to drown. You know that's a smart animal because you have pictures all around the room on the walls. And when that animal sits on that block of wood, it can triangulate where it is. And so the second time you put it in there, it goes right to the block of wood. And you say, boy, that is a very smart animal. However, they've done tests with all drugs, and this includes THC, nicotine. If you drug up the animal, they cannot find that block of wood to save their life. They have to keep swimming until they bump into it because they just can't learn. However, this is also recoverable, which is great to know. What they do is they take the drugs away from those animals and put them in an environment where to their heart's content. Because one of the things we know that improves neurogenesis in the hippocampus is voluntary exercise. So this is why I advocate for treatment programs to have exercise every day. So once this animal has been drug-free for a while and has been exercising, they can find the block of wood. Then we also have this problem where it affects your stomach. And this is something that's relatively new. I mean, it's been around forever, but it's always been extremely rare. I think there were even recordings of it way back in the Middle Ages, where some people had this, what's called an idiosyncratic reaction, meaning it's not supposed to happen, but it does, to cannabis. Now, cannabis is supposed to be useful for nausea and vomiting. However, what we're finding is with the higher potency that is causing more addiction, meaning people are using more regularly, like people are using daily, sometimes multiple times a day, they develop some severe abdominal pain, nausea, and vomiting. And it's uncontrolled vomiting. They cannot stop. So it's just cyclical and it just keeps going and going and going. These people are now flooding the emergency rooms in Colorado. And since many people that work in those places are not aware of this, they're not asking the right questions, they're not really getting the right history. And so people are getting full workups costing hundreds of thousands of dollars to try and find out why they're having such severe abdominal pain, nausea, and vomiting. And the medications we have don't really work very well. And what we have found is that people that have this often get some symptom relief with hot showers. So that's kind of a key that some people have this. And what we found is the only solution is to quit. But because people are now addicted to it, it's very difficult to quit. We don't have any medications right now currently that help with withdrawal syndrome from marijuana. And so that is something that people need a lot, and sometimes people may need to go to treatment to actually help quit. So basically, I hope that people will end up making good choices. Yeah, you know, this is your choice to determine whether you're going to start on marijuana or not, or any other addictive drug. And my strong recommendation is that you don't make a decision to do this until your mid-20s. Wait until your brain is fully developed. And then you won't have the significant problems. You may make a decision to start using, but you might use it much more responsibly and you won't become addicted so quickly. And so this is what I recommend for all addictive drugs. So that would include alcohol and nicotine, but also marijuana. All right, so that's actually what I have. So I'm happy to take any questions.
All right, thank you. Let me get you off webcam, or we'll just stop sharing here. There, can you see me again?
Yes, I can.
Excellent. Okay, so we have plenty of time to ask Dr. Stuyt your questions. I know there are many concerned adults on with us today. We have many parents, sadly, who are struggling with addiction from their young ones. And so now is the time that you can get some private one-on-one coaching with our addiction psychiatrist, Dr. Stuyt. Please feel free to type questions. I will keep you anonymous so you can ask your personal questions about your loved one, and Dr. Stuyt can take those. So now is your chance. All right. Question number one, Dr. Libby. Are there any benefits to Tigan? I won't even try to say it for CHE, for cannabis hyperemesis syndrome. Trimethylbenzamide.
Right. There are many attempts to try multiple different antiemetics, and I think it's appropriate to try. What I've seen most helpful, sadly, are things like Haldol, which is a very potent antipsychotic, but it also works for nausea. And so, yeah, I mean, the things that we normally use, like Zofran, don't really seem to cut it. And it's just, I think it's appropriate to try different things, but I haven't seen much benefit.
Haven't seen much help? Okay. Yeah. Let's see. What about dopamine replacement to treat? This person, Bill's asking about meth addiction. Any benefit of carbidopa or levodopa for dopamine replacements? And what are your thoughts on using that to treat meth addiction based on more recent studies? This is from your friendly Jersey pharmacist. So what are your thoughts on dopamine replacement, Dr. Stuyt?
I haven't been impressed with this clinically at all. I think, you know, scientifically or, you know, thinking about it, oh yeah, that might be really good. But I'm not sure. I think it's better to go the route of trying to support the nutrition, because we create our own dopamine in the brain, and that you need the nutritional basis for that. So you need the amino acids and the micronutrients, vitamins and minerals that are associated in that process. So that's what I suggest people do more, is going through trying to really get healthy and using micronutrient supplements to help with that.
Okay.
And that's what I would say.
Okay, great. Please update us on what's happening in Colorado with the bill to lower marijuana potency level. You want to give everyone a quick update just on our activities, Libby, and what you know of the status of that?
Yeah, I don't know much. I do know that it hasn't been introduced yet, but it's still in the process. I think they're still working with stakeholders and trying to come up with as much support as possible. And I think there is a great deal of support for this. There's a lot of fight from the cannabis industry. So because the attempt is to put a cap on potency, and I don't know what the negotiations have come out to. I don't know what the potency might be. I just know what I recommend, and I would love to see at least a cap on medical marijuana, because we're saying that it's medicine, but there's no research out there for anything greater than 10%. And so to me, to my mind, medical marijuana ought to be limited to 10% or less, and there should be no concentrates, because we don't have any research on concentrates that are medically benefit. To me, all those concentrates are for is to get high and increase the addiction potential. So so anyway, I know that it's in process, and it's just we're working on it. Hopefully it will be introduced this coming week, I hope.
And that would help if at least the medical could be limited. It would put some bumpers perhaps on that 18 to 20-year-old gap in their ability to get a hold of a medical marijuana card, and maybe it'll still be everywhere, but it might make it a little more difficult for them to get a hold of it. They still will, but perhaps with the high potency going down and using less potent, perhaps that could help. We shall see.
Yeah, and I'm really hoping that we do establish kind of a medical marijuana, prescription monitoring program,
Yes.
whatever you want to call it, because it's just insane that a doctor can just make a recommendation, especially to an 18-year-old, not tell them what to get, what to use, how often, and just give them the card, and then they go purchase shatter. And now I'm understanding they can get like 40 grams of shatter in one meeting. I mean, that's like crazy.
And it's not for personal use. You can't even use that much in, a month. So of course they're selling it.
Right. Of course they're selling it. Yes.
Yeah.
Yes.
Yeah, don't get me started. We're staying focused here on addiction. Okay, have you heard of the International Academy of the Science and Impact of Cannabis, doctors educating on cannabis? It seems to be a newly formed group of medical professionals researching and speaking about the dangers of marijuana, and you would be a great addition to this team.
I think I've just been invited to be on there.
Oh.
So, yeah.
Well, we will send them all of your videos that you've done for Johnny's Ambassadors, if not, so they know how much you are needed on there. Do you have any specific micronutrients that you would recommend for those who are addicted or who are recovering from cannabis-induced either withdrawals or psychosis or whatever it is, especially with those brain patterns that you showed? Is there any, you mentioned diet, specific micronutrients that would help with that uptake?
Well, I mean, the research is not that great out there yet. It's just in my experience working with the Circle program, I did help quite a few people moving off of psychotropic medication onto micronutrients to help them, with their symptoms, and with great success. And so there's several companies out there that provide this. The one I've used the most is called Hardy's Nutritionals. They're based out of Canada. And then there's another one called True Hope. They used to be together. Those two companies used to be together, but they split off and have two separate companies, but they still do the same things. And so I think still need the research, definitely.
Okay. Excellent. Let's see. What is the best way to present this information to teens and young adults? That's a good one.
Yeah.
How do we get them to listen? I mean, they know everything, of course, when they're 15 years old, and, oh, that would never happen to me. And, all my friends use weed. Everyone's dabbing. So-and-so has been dabbing for 5 years and he's fine. How do we get them to understand the seriousness of this and how damaging it will be?
Yeah. Well, no, the kids do believe they're invincible at that age. What I found, you have to get them before they start using. That's the key, because once somebody is using, it is very hard to get through to anybody. I mean, if you've ever talked to a smoker about quitting smoking, when they're actively using, they cannot even think about it.
Can't even hear you. It's like talking to a wall.
Because the brain is not working. I mean, it really does suppress neurogenesis. I mean, it really does affect that. And so this is why the prevention efforts have to start really early. The good thing is we're seeing some really smart kids out there and they're getting the message. And so I just saw some information that more and more young people are making the choice not to use, which is something we really have to push. Those are very smart kids. So the kids that are already using, I think, we focus on things that get to them. Like, do you think you're smart? I mean, I think you have to talk about the effect on the brain, and, they may not think it's affecting them, but then test their cognition. And then the other thing that this doesn't work with the young ladies, but it does work with the young men, is the effect of marijuana on testosterone, and the fact that it actually can decrease testosterone. And that's why, long-term heavy marijuana smokers often have gynecomastia, which is development of breasts, because they have increased estrogen compared to testosterone. And then they also can develop testicular shrinkage. And it can affect their ability to, produce sperm. So those are things that can get some young men like their attention. I have gotten some young men their attention in that regard. But the young lady,
especially, reduced potency, pardon the pun, or fertility, or the term I've heard, doobie boobies.
yes.
That's a little crass, but young men, that's their language. They don't want to lose their pride, and certainly we have to get them at a young age. What age do you recommend starting to talk to children about drug use, addiction, substances?
8, 9.
Okay, there you have it, folks. And obviously, someone here says, tell them in small tidbits, wisdom words. But by the time they get into middle school, this is going to be there. I don't know the latest data from the Colorado Department of Public Health and Environment for 2020 because of COVID, but in 2019, I believe it was 1 in 10 middle schoolers use marijuana. We're talking 6th, 7th, 8th grade, which is 12, 13 years old. And so certainly, when Johnny started at 14, and at the time of his death, he was 19, so this was a 5-year progression. And so we've got to get them, even in 3rd grade, 4th grade, beginning to talk about these type of things so that they're prepared, or they won't be able to stand up to the peer pressure.
Right. I found that 9-year-olds, that's the age where kids really have it together. They know what they want. They know how things are going. And then something happens. They reach puberty and their parents are going, what happened to my kid?
Their brain left them.
Yeah, exactly. Yeah.
Okay. Our child gets occasional random testing. So for example, she says from April 2nd of this year, 106 nanograms per milliliter, 117 nanograms of THC to creatine. As parents, we were told that the creatine ratio is what matters to get accurate levels. However, we can't seem to find a clear explanation online. Can you please explain this, and is this result concerning? So again, it was 106 to 117 THC to creatine.
And how old is the child?
Nadia, can you chime in? 18.
18. Yeah, well, just the presence period is concerning, I think. Usually what they're looking at with the creatine is to see how dilute or concentrated the urine is. Because if it's very high, then it's a very concentrated sample. And so that may not be that big a deal. If it's very dilute, like the creatine is almost not there, that's how people can pass urine. Drink a lot of fluid, and so then the creatine is really low, and that's how you can tell, well, maybe people are trying to, not pass it, or not, pass the drug screen.
But you're saying that regardless with that level of THC being measured, that is a positive screen for THC.
Right.
That's what the bottom line is. Okay. So maybe an attempt to dilute it. Okay. Let's see. How about, okay. Oh, this is Sally. Agree with ages 8 to 9, Libby. Their parents may be 25 to 30 with their own brains, only currently reaching brain maturity. This is a really important point, Sally, and I've never actually thought of that, but you're absolutely right. With a young male being upwards of 28, 30, women, they say even in their mid to late 20s, they themselves having kids. Sally said, I think we should be teaching the 8-year-olds how to tell their parents that they want to grow up drug-free.
Yeah, I agree with Sally completely, because in many cases, I have found the kids to be the smarter ones than the adults.
Wow.
The kids at that age are much more in tune with what's going on than their parents are.
Sally's, yes. Sadly. Well, and if you have an adult, we're not certainly saying that just because you're 21 and you're choosing to use that it's safe for your brain. It's not. Your brain is still forming, and even as adults, there are harms. I have a friend who's 51 who allows me to share her story. Her name is Heidi. I grew up with her in junior high school. She moved out of state, came back to Colorado to visit a friend, used a dab pen, 2 hits at a restaurant for lunch off her friend's dab pen, and wound up in a mental hospital for 2 weeks hallucinating. She said that her the wardens there were shapeshifters. I mean, so this isn't just necessarily, although we focus on youth in this conference because that's what we Johnny's Ambassadors does, is youth marijuana prevention, but that doesn't mean that adults who are themselves parents are not going to have these harms. And certainly when they're using, they are impaired, which you mentioned the cannabis hyperemesis syndrome. I'm sure that part of that is the impairment of the parent from being careless. I mean, if you're high, how much more likely are you to accidentally leave something out, right? Where a child can get a hold of it. So I think that's a really critical point.
Right. You're right.
Okay, let's see. How about, I can't even pronounce these, Remeron for meth addiction. And although we're certainly focused on marijuana, there are, Libby is an addiction expert. Have you seen any positive effects of Remeron for meth addiction in the newer data?
I mean, it's not really specific for meth addiction. I have used Remeron effectively in some people with both marijuana addiction and meth addiction. When you're looking at people who really can't sleep or can't eat, because Remeron is an antidepressant. It's an SNRI kind of antidepressant, but at lower doses, it works primarily for sleep, and it really improves appetite. So one of the biggest side effects of it is weight gain. So if it's somebody who's already quite big, they might not really like it. They might not benefit from it. But so you're really treating for symptoms. It's not like you take Remeron and you stop using meth. The person has to want to quit meth, but then they're saying, I just can't sleep. But with meth, most people, when they quit meth, they eat like crazy because meth is an appetite suppressant. And so it, when you quit, then you're more likely to eat. And so that's why I've used it with meth addicts or people that are addicted to meth, because they've lost so much weight and they're really skinny. And so it has been a helpful choice in those cases. Marijuana creates munchies, but I've seen some of these people with cannabis hyperemesis syndrome, they just can't eat at all because it triggers a bout. And so I've tried Remeron with those people too.
Okay.
With some benefit. I mean, nothing is hard and fast helpful.
We had a webinar with Sir Robin Murray from King's College in London, and he was going over his research, and someone asked him what they use there in London for cannabis withdrawal and for the symptoms. And we don't have it available here in the US, he said, but he has been using Sativex with success. Do you know if that is something that is being looked at right now by the FDA? I don't know the status of that.
Yeah, I think it's been going under FDA approval, but it hasn't happened yet.
Okay.
And I can see where that might be helpful. I mean, it's kind of the similar thing of using methadone for opiate dependence.
Or a patch when trying to get over nicotine, or
Yeah, exactly. Yeah.
What do you think about the parents who have a child currently who is going through withdrawals. Okay, so we have a child who is not currently using marijuana, but is clearly suffering from that. How long will that take them to feel better once sober, and how can we help?
Yeah, that's a great question. And it really differs for everyone because it depends on how heavily they've been using, how long they've been using, and their body fat. Because marijuana is lipophilic, it attaches to fat cells. And if the person has more adipose tissue, then it's going to last longer. And so I've seen people in treatment, so they're in a controlled environment. I know they're not using, but they were using daily up to admission. And I've seen people with still positive urines almost 3 months out, but that was really heavy use. And so it just depends on the potency, the frequency, and the adipose tissue that the person has. And the other thing that's kind of fascinating is I've seen people where they come in and they become negative, their urine becomes negative, but then they start exercising and then their urine becomes positive again. And that's just because they're, kind of leaching out stored body fat, THC, so it's still floating around in their system.
I've never heard of that.
And yeah.
So if it's been, let's say one individual is 4 weeks before showing a negative tox and another individual's 2 months, at whatever point the person ends up, excreting all of the THC from those deposits, is it at that point where now their brains are making no dopamine and now they're starting at zero and have to start up again, and that's like horrible, awful? Or is by the time the THC gone has exited the body, have they already started making some dopamine, right?
Yeah.
When does that start? When is the most awful period, I guess is what I'm asking.
Again, everybody's different. What I've found that people are using like really heavily daily, a large amount, they can feel miserable for several weeks, like really miserable for several weeks. And then it starts getting better and better. People that haven't been using that heavily, usually the withdrawal is only like 3 to 7 days, and then they feel better.
Okay.
So it just depends on, again, the potency and the frequency.
And then from that point, with continued soberness, they will continue to feel better.
Right.
With psychosis, when you see psychosis in your practice with addiction, how often is it that a person can heal? Let's say the addiction is over, right? They've gone through that, they're a year in, but they're still experiencing some of the effects on the mind. I've heard of some people still needing to be on antipsychotics for 6 months, 12 months. Are there instances where the brain simply does not heal?
Well, sure. I mean, if that person has kind of transitioned over into schizophrenia, that's usually going to be kind of permanent, which is really sad. But I have worked with people that, they had that cannabis-induced psychosis, they were stabilized on antipsychotics, and then were stable for some period of time, and then I could take them off the antipsychotics, and they did well. I've also had those people that did well and then relapsed to marijuana and then got psychotic again and never came back.
And that is what happened to Johnny. He relapsed several times, would heal, would be fine, and then sadly would go back. And then in a combination of not taking his antipsychotics, which of course is a function of the disease, because of course he's fine, right? It's our brains that are the broken ones, would relapse and go back into psychosis. And then it reached a point where it didn't go away, and that's something we really want to leave with people. And I can't thank you enough, Libby, for your insight and your wisdom, because it's really critical that it is never too late if your child is using, if your teen is using, to get them to stop. Any way that you can. Treatment centers, residential treatment. I would have sent Johnny out of state in a way, and you know, if I would have known what I don't know now. And so thank you
Yeah.
for educating us and helping us with the tools that we need to help our teens that we love very much. Thanks so much, Libby, for being one of Johnny's ambassadors.
Yeah, well, that's what I loved about having the Circle program, being able to do that, having people being there for 3 months and then people really recovering. I mean, doing really, really well, but it takes time. Yeah.
And, you know, insurance is very callous about it sometimes, like, oh, we're in Colorado, it's just marijuana. And, you know, I know our insurance never wanted to pay for a thing when it came to treatment because we're in Colorado and it's just so normal. It's just weed, you know, according to Ben Court's presentation. But it's going to take a lot of continued noise making as you are doing very effectively with our legislators. So I have appreciated all the time that we've spent together, and I've learned so much from you, Libby. Thank you so much.
Thank you. Thanks.